we've actually witnessed mega developments in the county. As we've always been telling the public, for the last financial year and the first financial year when when Patrick Ntutu became the governor, we've been able to build 76 new health facilities in the county. Again, what the governor is doing, we are trying our level best to make sure that by next year, all our level 4 facilities will be functional and operational. So for the people, we will not need to refer patients outside our county. And that was the aim of the governor since the beginning. We are completing our new referral hospital here, which will be a level 5. And as we speak right now, our focus is to equip all level 4 hospitals and the mega level 5 hospital, so that the services that are offered here in the referral hospital will be available in all level 4 hospitals.
First of all, we have sorted out the issue of the pending bills. We have paid the total amount, which was about 79 million shilling. Number two, we have reduced the number because as a county government, since I came in, we have improved a lot of the health services in our smallest unit of administration. That is the dispensaries and the health centers. And then the level 4 hospital, now we are operationalizing. So we have, from the advice that I'm getting from the health practitioners, is that we only need 6. Why 6? We have 6 main sub-counties in our county. And so we have dispatched 1 to every sub-county level 4 hospital. Meaning that if anybody needs the services of the ambulance, you have to get clearance from the MOH. The MOH is the one who clears that we need an ambulance because of some emergency. For a long time, these ambulances have been misused. And misusing the ambulance, it means that the county government will pay more money. We also realized that the agreement had expired. So we could not work with an agreement that had expired. So we have now renewed the agreement, and we have sat down with the providers, and we have all agreed that the best way to manage this ambulance is going to be managed by the level 4 hospital in our